if we can work with trans communities to find the right language and effort for intersectional approaches to good access to healthcare and education and preparation for both providers and residents and citizens in the city, we can take those lessons learned and apply it to racial equity work at large and cross-cultural work at large. And let's work together with those other organizations. So it's not just racial equity work, but it's racial equity and SOGI work together, right? We have a bigger impact that way.
So this project is with the Office of Transgender Initiatives and Adobe in attempts to support and amplify their communication strategy for the transgender, gender nonconforming community. So we'll start with some introductions. Maceo, if you want to go first and introduce OTI's team.
Yeah, I am so honored to be a part of this and so thankful for this Civic Bridge program, first of all. And I want to, I'm just so excited to introduce my colleagues because this has truly been a team effort among our office. And so our incredible director, Claire Farley, and our communications associate, Pax Ahimsa Gethin, have really played a huge part in also developing the projects in this. So I just want to give a thank you to them. And a big thank you to Adobe as well, as you all have been so generous and just a pleasure to work with. So.
Thank you, Maceo. For the Adobe team, we had a pretty diverse group. Christy is a social media manager. Kevin is a senior manager of public relations. Jackie Chang is a software quality engineer. And myself, Elle Waters, I'm an accessibility product manager. So that was one of the benefits, I think, of this when approaching this challenge. So Maceo, maybe you can talk a little bit about the background and the challenge that you were facing.
Yeah, so we know that trans and gender nonconforming communities face an incredible amount of barriers as well as social and economic inequities. One example of this is that we've learned that in San Francisco, trans and gender nonconforming people are 18 times more likely to face homelessness than other San Franciscans. And that's really significant. We also know that trans individuals often face discrimination and mistreatment and disrespect when going to seek general services. So in result, more than half of TGNC people, trans and gender nonconforming people, in a national survey put off seeing a doctor to avoid mistreatment because they can't afford it, or because they don't want to be mistreated. And this is sort of the context in which we live. And the challenge that we have is that there's a big mistrust or lack of access to regular services. So we are really asking, how can our office support city departments to appropriately communicate city services to trans and gender nonconforming community members and become more welcoming? And then the other piece that we had is how can OTI put together a communication strategy to efficiently and effectively communicate city services with broader community?
So when we're looking about how we wanted to approach this problem and really tackle this challenge and meet it, we saw it as two distinct kind of workflows for our project. One was when we're looking at helping support city departments, we wanted to conduct some stakeholder interviews and create a community survey to understand what some of those gaps were in being able to support city departments' work with the TGNC community. And then on the second side of that, we're looking at the community themselves. These individuals, how are they getting this information from OTI and others? And so we worked to create a public relations strategy and to analyze and enhance OTI's already existing social media communications strategy. So very quickly, I'll go through some of the things that we did during this project in order to be able to tackle that. So the stakeholder interviews, one of the wonderful things that we discovered is that OTI has incredibly deep and established relationships with a lot of partner organizations. So we interviewed 6 different individuals who work on behalf of transgender and gender nonconforming communities in the city and asked them lots of questions to understand what the gap was, how the community that they served and the individuals that they saw were faring under the pandemic, knowing that we had all these other challenges previous to the pandemic that these communities were at risk for. So we got a tremendous amount of information from these individuals who are really experts in the field, and that helped us shape our survey. So we created a survey with 40 questions, a little about general information about the participant, about COVID-19 testing and vaccinations, and about mental health and mental health services. We published it in English and in Spanish, and we got 208 participants across the Bay Area. And very quickly, I'll share some of the findings. One of the things that we noticed is out of 181 responses when asking, how would you rate your own mental health? 42% of all participants said that their mental health was either somewhat poor or poor, which is somewhat to be expected given all of the things that people were going through last year. However, what was noticeable to us that 67% of the participants who were 24 and younger said that their mental health was somewhat poor or poor. So even a harder hit to the younger group in this community. And then when asked, why haven't you accessed any of the low cost or free mental health and wellness services, out of the 88 responses that we got, two very remarkable categories kind of surfaced. One is lack of education. Individuals didn't know they were available. They didn't know how to access them. They didn't know if they could afford them. But then 46% of the responses were about whether or not they felt safe, whether or not they felt trusted and respected and understood by the provider. And so I think we really determined this creates a lot of opportunity for bridging those communication gaps. And then finally, in this particular survey, how can the city improve in connecting you to available resources? I thought this quote was really poignant because we had a lot of opportunity for people to just share in free form what their responses were. I work for LGBT older adults and would like to take this opportunity to speak for them. It's been really hard for most of them to get access or even be part of anything because they don't have internet access. I wish there was a way they could participate or keep informed about programs, maybe send a mailer with wellness activities or something like that that they can see. So these things then helped us. Maceo is going to talk a little bit about the outward communication strategies as well.
So some of the things that we worked on or sort of developed more is looking at our tools. So social media is an incredible tool for us to engage with and to talk with our community. With Adobe, we got the slide deck of best practices around social media work and how to communicate with community. We also finally made official sort of our Trans-City SF social media sites as well. So now we see the blue check mark on our Twitter account and our Instagram, and we developed a social media calendaring tool. One huge thing is that a memorable moment is that San Francisco, like we said earlier, is a leader for the country. And that's so important right now to communicate to our people, both what our services are for our trans and gender non-conforming community, but also as the country is continuing to push a record number of anti-trans legislation. We keep seeing anti-trans violence. It's so important for us to show our country that a different reality is possible, and that San Francisco is that light, that we are building services for trans communities, and we're making a city that is for all, truly for all.
So let's talk about our key insights, Maceo. Some of the things that you felt like you discovered and that I discovered and our teams when working together came across in looking at these different activities. So one of the things I'll say is I think that it's really important for us to recognize that we know community is important with certain groups, but when you're suddenly taken out of that opportunity and to be able to meet in person and that social distancing, it really becomes that much more profound, the impact on that community with regards to trust and knowing that you have a connection to a larger group.
Yeah, and I would definitely say that trust is one of the key issues in order to make services accessible for trans and gender nonconforming communities, and that can be fragile. So embracing every way that you can build that trust is important, which includes representation both in digital content and in your communications, but even deeper than that, and having representation in your staff, as well as having a deep and real relationships with the organizations on the ground that community members are connecting to.
So speaking of representation, maybe we should talk a little bit about what's next for OTI, because you have some really cool stuff that I want to be able to have time to share.
Sure. So one of the pieces that we are wanting to do next is build a media and communications toolkit to support departments when communicating in the press or in the media about transgender non-conforming people, about issues regarding sexual orientation and gender identity, to have more tools available for our folks. Another one is to develop an internal sort of social media communications roadmap to sort of plan out the work that we want to do throughout the year or in the future. And then another piece is that we have been working pretty closely now lately with the COVID Command Center. And so we want to continue that work to deepen the relationships that trans and gender non-conforming organizations have to the COVID Command Center and to making sure that we can all be a part of the work and the solution in eliminating the pandemic.
So on the screen, you want to talk a little bit about what these flyers are, these posters, this artwork?
So one of the examples is that at one point, a lot of our organizations that we work with were asking us questions about the vaccine. How are they going to get it? How will it impact trans people specifically? So we knew that we needed to engage trans people in a specific way around this. So we put together a town hall. We worked with organizations who are serving trans communities on doing a vaccine drive. And the other piece is making sure that people feel represented in the ongoing communications around our COVID relief effort. And so this included this pride campaign that the communications team at the COVID Command Center made that features really like LGBT community and a really big and real and profound part of San Francisco and who we are in our vaccine efforts.
That's awesome.
So in terms of next steps for the folks that we are working with and sort of for everyone, one of the big key things is to get trained. One thing that we know is that we need to equip our frontline staff with the tools and the information that they need so they will feel confident in serving our communities, so that people can learn to engage with TNC community both digitally and offline. Again, like both building those relationships over social media, but also developing those relationships on the ground. Partner with trusted organizations that support trans and gender nonconforming communities, understand the impacts of intersectionality and discrimination for our communities. I think one thing that is very clear, right, is that these issues have affected Black, Indigenous, Latinx, people of color, trans communities differently, and often more deeply. Build relationships. Yeah.
Sorry, I'm just looking at the time.
Yeah.
So we'll send this to you. There's tons of extra work that people can dive into. A lot of it has to do with partnering with organizations like OTI. Maceo mentioned representation and how much it matters. This is another quote from the survey. One time there was a trans guy working the site. He was checking people in. I felt so safe and happy to see another trans person involved in the process. Please employ more trans people because it means a lot to see them.